Why is contact dermatitis often misdiagnosed? Imagine having a skin rash that keeps changing, looks similar to other skin problems, and no one can tell you exactly what it is. That's often the case with contact dermatitis. It can be tricky to diagnose because its symptoms and causes overlap with many other skin conditions. Doctors usually relying on asking detailed questions about your exposure to certain substances and examining your skin, rather than doing a quick blood test or biopsy. There are two main types of contact dermatitis. One is irritant contact dermatitis, which happens when your skin gets damaged by things like soaps, detergents, or solvents. The other is allergic contact dermatitis, which is an immune response to allergens such as nickel jewelry, fragrances, or poison ivy. Both types can cause redness, itching, swelling, and rashes, but their triggers and how they develop are quite different. This makes it harder for doctors to tell them apart just by looking. Since many skin conditions share similar symptoms, it's easy to mistake contact dermatitis for eczema, psoriasis, or fungal infections. For example, eczema also causes dry, itchy, inflamed skin, so without careful investigation, it can be confusing. Irritant contact dermatitis does not involve the immune system, so there's no simple test for it. Instead, diagnosis depends on understanding what substances you've been exposed to and where the rash appears. For allergic contact dermatitis, doctors can use patch testing to identify specific allergens causing the reaction. But this test takes time, costs money, and needs a specialist to interpret the results. It also doesn't detect irritant contact dermatitis, which can be caused by many everyday products. Because many patients don't get patch testing, their exact cause remains uncertain, making treatment more difficult. Symptoms can also appear after a delay or spread to other parts of your body, especially with allergic reactions. This delay can make it hard to remember what caused the rash or where you were exposed. People with pre-existing eczema are more prone to irritant contact dermatitis, and the overlapping symptoms can make it even more challenging to tell the two apart. In some jobs, exposure to irritants or allergens is common, but workers may not realize their skin issues are related to their work environment. This can delay diagnosis and treatment. Overall, contact dermatitis is often misdiagnosed because it looks like other skin problems. Testing isn't always straightforward, and symptoms can be confusing. A careful medical history, awareness of environmental exposures, and sometimes patch testing are key to getting it right and managing it effectively.